Is it true you lose hair when you first start using Rogaine? Yes, that's actually true, but it's okay and I'm going to explain why. Hi, I'm a board certified dermatologist, and in this video I'm going to explain everything there is to know about Rogaine and what I tell my patients when I want them to start using it. What we use it for, how to apply it, when to expect results, and expectations. Now before I get into the details, I'll say this. For over-the-counter options, Rogaine or Minoxidil is the single best option out there to treat male and female pattern hair loss. How do you apply Rogaine? What I recommend is buying the 5% solution or foam. It's only once a day, which makes it a lot easier to do. And you can apply it in the morning or at night, before you style your hair or before you go to bed, just not before you shower. And what you do is you part your hair down the middle, apply a few drops and then rub it in, and a third of the way over and a third of the way over here, and do the same thing. If you're using the solution, I recommend putting it in a little mini travel spray bottle, and then it's much easier to apply. So I started Rogaine. When do I see results? I always give it at least 6 months to start seeing results. And your expectations for results are to have the same amount of hair as when you started. The goal is to keep the hair you have and not lose more. If you get regrowth, that's a huge bonus. Now there is something when you first start using Rogaine called the dread shed. That's when you shed a lot more hair in the first month or so when using it. That's to be expected, and that actually means it's working. Those hairs that you're losing were all going to fall out at some point. Minoxidil is just speeding along that process so that new hairs can start growing again faster and thicker. Where should you get Rogaine? The cheapest place is Costco, but you can also get the Kirkland version on Amazon. And the last important thing to know about Rogaine is that if you're using it for genetic hair loss, once you start using it, you have to keep using it. If you use it for 2 years and get great results and then stop, you're going to start shedding to the point where you would have been had you never used it before. So it's a commitment. And my last tip, what if you're seeing good results with minoxidil, but you want more? That's when seeing a dermatologist can be really helpful. We can get higher strengths of Rogaine compounded with other ingredients to help hair loss. So you can get 6 or 7% Rogaine plus finasteride, spironolactone, retinoids, which all have been shown to be helpful for genetic hair loss. I certainly hope that was helpful. Follow for more tips.